This video will cover subjective progress note documentation. This video will cover the chief complaint section on the progress note. Let's begin by opening the progress note. The chief complaint field that you see here will pull from the reason on the appointment window. If the patient had been seen previously and you wish to carry forward the same complaint, you can use the yellow caret found to the right of the section link. From this window, you can choose a complaint that you have documented for this patient previously, or you can view all providers' documentation. Click on the More Details button to see additional encounters display. Use the Expand and Collapse button to see additional complaints. The system will display the two most recent visits by default. If you wish, select the complaint and then click either Copy or Merge. Copy will replace the existing chief complaint, and Merge will append it. This section can also be modified by opening the link. You can also access the chief complaint window by clicking on the 3 paper icon found in the Progress Note toolbar. From this window, you can either free text into the blank line, or you can choose an option from the list above by typing in a keyword in the search field. After you begin typing, a drop-down list will display with all matching keywords. Use the arrows, left or right, to see additional options. When you find the complaint that you want to add, simply click on it. You will also notice these small star icons. These stars represent favorites. To add a favorite, select the star to the right of the keyword in the drop-down list. Next time you enter the screen, you can activate your favorites by clicking on the large star icon to the right of the keyword field. When it's yellow, you are viewing only your favorite list. When it's white, you are viewing all complaints. Keywords can be added to the list by clicking on this plus sign. Please note that this requires a security setting permission. The security setting is Allow Customization. This permits customization for different sections in the progress note. If you have permissions, you can go ahead and name the complaint, which is visible in the keyword search dropdown. Please note, if you add something to the notes field, the note is what will actually appear on the encounter. For example, if I were to name this physical adult, and in the notes field, enter new patient physical and click OK, if I go ahead and look up physical adult. So if I were to select this keyword, you will notice that the note is what will appear. You can also edit the name of the keyword if you have the customization setting by clicking on the pencil icon. If you wish to remove a keyword from the list, click on the X to remove the item from the master list. Once you've added your complaints, you can reorder them in the desired preference by selecting the double arrow found in the left column and dragging and dropping it. To remove a complaint for this patient's encounter, use the trash can symbol found to the right. Another step that may be of importance to your practice is reporting of health information exchange data for quality incentives such as the MIPS program. This is known as transition of care. This button can be found in the Chief Complaints window on the top right. The full measure requirement definition can be found at qpp.cms.gov. In short, to meet this measure, the number of transitions of care and referrals in the denominator must include a summary of care record and was created using a certified EHR and exchanged electronically. In this window, you will see a red warning if the summary was not included on the incoming referral. Any referrals received through P2P will display below. To link a referral to this transition of care, select the incoming referral and appropriate measure requirements, then click OK in the bottom right corner to save it. The Transition of Care button will now display with a green check mark, verifying that you have completed the Transition of Care confirmation. Let's take a look at the progress note to see what it looks like. Here we can see all of our different chief complaints.
Hello. In this video, we will cover the HBI, or History of Present Illness section of the progress note. The HBI can be accessed multiple ways. It's first important to know that we can simply select the HBI hyperlink, and this will automatically open up to our History of Present Illness window where we can document. It's also important that regardless of where you are within the patient's progress note, for example, my chief complaints, I have the ability to navigate simply by selecting the icon here, or I can select from the Encounters drop-down menu, HBI. Now, there's multiple ways that I can document my History of Present Illness section. We're first going to close out, and I'm going to look at the caret located to the right of the HBI link. If my patient has been seen previously and I want to carry forward some of the details, I would simply select the yellow caret to the right of this section. From here, I can choose from a specified facility or specialty. I can choose from anything that I've previously documented versus all providers. Now, by default, it's going to pull in my last 5 most recent notes, but I have the ability to change the number of results listed on the bottom left. From here, if I wanted, I could simply select either, if there was multiple assessments, I could select from this checkbox here, and it would select all of the notes listed within for this particular category, or I could just check off the one section that I wanted. From here, I have the option to copy, or I have the option to merge. Copy will override any of the existing information that may have already been documented. Merge will include that additional information. Please note, if this is a new patient, this window will indeed be blank. You can also document the HBI using the Quick Note button found to the right of the caret. In this case, I can edit the information that I just merged into the patient's progress note. Can make any changes from there and then select OK. I also have the option to perhaps bold something, underline it, etc. Once I've done that, I can select OK. Additionally, next to the HBI, I also have an in-place note where I can add additional information from here. I can simply select from the section I want to document and then document as needed. Another option is the main HBI window. You will see the categories on the left. Subcategories will be listed under the parent categories. So, for example, this is a primary category, and this is a subcategory housed within that particular category. Simply click to expand or minimize as needed. Any categories that are selected will appear as a tab along the top. Below the category, you will see the symptoms and notes. If the list of items is lengthy, you can use the search link to find it quickly. Select the symptom to open the window and add details. The symptom will display at the top, and on the left-hand side, you will see a list of keywords to select from. This can be customized if you have the security permissions to allow customizations. Select an item on the left-hand side will bring it over to the Notes pane and display on the right. Below the Notes section, you will see a series of drop-downs to choose from, which allows you to add additional details to your Notes section, using the Previous and Next button to access additional symptoms. This drop-down arrow displays the symptoms for which you have already documented notes for, but gives you quick access for further modifications. Click OK once you have saved and closed. The CO column, or Complaints of column, can be selected to identify that symptom as a complaint. If the checkbox for Show Pop-up for CO in the upper right-hand side is selected, then the detailed notes will automatically pop up. If a patient denies a symptom, you can use the Denies column to mark it. To move through the items more quickly, select the Denies All option, then go back and individually deselect the Denies option for any symptoms that the patient is complaining of. The header and footer allow you to add the notes as a preface or suffix to the notes on the specific category that you are documenting in. You can free text in the field provided or use the ellipsis to select from any of the customized keywords. There is also an option to run a spell check and clear notes. You can also change the order that the documented categories will display on the progress note. Click the Order button found on the top right, and then drag and drop to change the order in which they will display. Once completed, select OK. Structured data items may also be available and will appear with a blue S, or in this case a red S because there are mandatory fields that are required. Structured items are customized in a way that allows for reporting and will allow for an additional triggered question based on the response provided. Structured data can be customized by your administrator or those that have the appropriate security settings to create it. The structured data window will be the same in all areas of the progress note. There will be a default option and default for all along with clear and clear all buttons. These default options will be discussed further in the template training option. To clear notes for a symptom, select the X on the right-hand side. To clear notes entered for a specific category, select Clear Category. It will give you a pop-up message asking if you want to clear all the data. Simply select Yes. Lastly, note that the category, symptoms, and symptom notes are all hyperlinks. The category will open the specific category in the main HBI window. The symptoms will open the specific symptoms to make edits as needed. And the symptom notes will open the click-through window. This will allow you to make edits to the notes, navigate to other symptoms that may have notes entered already, and select another category that has been documented and needs editing. This concludes our video, and I thank you for watching.
Current medications. From our office visit screen, I will begin by selecting my patient name to launch the progress note. Prior to accessing the progress note, a user may be prompted to carry forward current medications. If I select Yes, when we access the progress note, we'll note that the current medication section is already populated with information. From here, I'm able to launch the current medication section by selecting the orange current medication hyperlink, or from the progress note toolbar, I can also select the pill icon. This will open our medication reconciliation window. Within this window, there are 4 tabs available: Current Medications, Past RX History, External RX History, and Unreconciled Past Medications. Any tab that appears in a red color indicates that the user needs to take action on the medications that are within that tab. Before we document current medications, users should view the patient's past RX history. Under the Past RX History tab, providers can review a patient's medication history from past encounters. The medications from the past encounters can be added to the current medications. If the patient is currently taking this medication, this will be represented by clicking the T icon. If the patient is not taking a medication, this will be represented by selecting the N icon. From here, we can go through and select the appropriate status of the medications that appear. The medications within the Past RX History tab can be searched using the medication search provided, or we can select the Group By dropdown and have the Past RX History display based off of encounter date, medication, or provider. When a selection is made, the window will automatically refresh based off the Group By selected. On the Past RX History tab, users will be able to see a stop date regardless of which grouping option we choose. It will also display any notes in the status of the medication. The H icon will allow users to select and open the prescription history for the specific medication. This will allow users to see when the medication was started, increased or decreased in dose, continued, stopped, or refilled. This can be viewed based off of a timeline view, which we are currently looking at, or a grid view. Note that the timeline view can be zoomed in to show 1 month, 3 months, 6 months, year to date, 1 year, and all. We also have the option to exclude the statuses of taking, not taking, discontinued, or unknown. Another way to look at medication history is to retrieve it from an external source using the External Rx History tab. Similar to our past Rx history, providers are also able to add medications from this tab to the Current Medications tab by updating the status to taking or not taking. It should also be noted that the patient's Rx history consent form must be signed and updated within the patient demographics, and users must check the Rx eligibility for information to appear on the External Rx History tab. We'll note that users have the option to click Rx eligibility to open the Rx eligibility window. From here, we can check the Rx eligibility, then set the formulary. Once this is performed, users will be able to retrieve the Rx external history. The external Rx history can be viewed by all 1 month, 3 months, 6 months, and 12 months. Additionally, we can group the information shown based off of medication and provider. Within the external Rx history, users will see the medication and strength, the number of fills, and the last date filled. We can click the Expand button to see additional information. It should be noted that the Rx eligibility feature works with the Rx Hub. If this is not enabled, this can be done through product activation or by contacting sales. Next, we will look at the unreconciled past medications. If the tab is red in color, it indicates that the medication list may not have been reconciled from a past encounter. From here, users can select the appropriate status for the medication. This can be marked as taking, not taking, unknown, or discontinued. If the medications shown are already listed under our current medications window, then this step is not necessary and we can dismiss the information on this page. We will now take a look at our Current Medications tab. Under the Current Medications tab, users can add any additional medications to the patient's list. To perform a medication search, type the name of the drug within the quick search field provided. For example, ibuprofen. A list of matching drugs will display within the drop-down. I can use the left and right-facing arrows to view additional medications if the desired medication does not display at first. It is also important to select a medication that has a green check mark next to it. The green check mark indicates that the drug has an associated NDC code. This is important when it comes to checking for drug interactions and for accurate reporting. We can also select the gray star to the right of the medication to add this to our favorited list of medications. This will turn the star blue, indicating that it is now added to the favorite list of medications. It is important to know that users can also select the star to the right of the quick search field to have the quick search only search through the user's list of favorited medications. Once I've found the desired medication to add to my patient list, I will select it. This will show some common strengths and formulations for the medication. I can select the strength from the list, which will then add it to my patient's medication reconciliation. Additionally, after I've searched my medication, if I want to make any changes to the medication information before adding it to my patient list, I can select the pencil icon, which will open our Rx Edit window. From here, I can make changes to either the take information, route, or frequency as needed. If the patient does not know or did not give dosing information, users have the option to select Add Without 𝒐𝒂. This will only add the name of the medication to the list. This is also similar to checking the Name Only option, then searching for a medication. From here, I won't be able to enter any dosing information if the Name Only option is selected. To edit dosing information for any medication on the Current Medications window, I can simply select the blue Drug Name to open the �ＲxEdit window. From here, I can change the take, route, and frequency information as needed. If applicable for this medication, there is the option for me to select taper. Users can also select PRN if the medication is only taken as needed, or type in any additional instructions on the line provided. If the medication is supposed to be dispensed as written and no substitutions allowed, this can be selected from the �ＲxEdit window as well. Below the additional instructions within the �ＲxEdit window, users will be able to see a preview of how the medication dosage and take instructions will appear. Once all current medications have been added, I can then proceed to update the status of the medications to taking, not taking, unknown, or discontinued by selecting the respective icons. Within the Current Notes tab, medications will be grouped by status. Currently, we can see that we had the statuses of taking and unknown. We have now updated our medications, and if we were to come back to the current medication windows, the additional statuses would appear. We also have the option to apply the same status from the prior visit if no changes have been made by selecting the respective button. Within the current medications window, the start and stop date can be added directly within the line items provided. The system will populate a stop date for any previously entered medication from past encounters. When a prescription stop date is past due, the system will remove the prescription automatically from the current medication section. Any patients with chronic conditions may take medications continually. 𝒣ClinicalWorks provides a configuration option to mark certain drug classes as chronic. If a prescription belongs to a chronic class, a stop date will not take effect for that medication unless it is added manually. Users can then select the Notes icon to access a standard list of keywords for any additional notes to be added to the medication information. Users can also select within the Notes field and manually type any additional information as needed. The order in which medications are shown can be changed by simply dragging and dropping them in the desired order. Any medication added in error can be removed by clicking the trash can icon. It should be noted there is an option to disable the deletion of medications within the medication reconciliation window. This is enabled by a setting under the visit code setup by an administrator. This will make it so medications cannot be deleted and a user must mark the medication as discontinued. Let's now take a look at adding duplicate medications. We can see in our patient list of current medications that they are currently on warfarin sodium. If a duplicate medication is selected that is part of the same family or class of medication listed under the current medications, for example, maybe I type in Coumadin and select it, a pop-up will appear warning the user. If necessary, and the patient is on a medication of the same family or class, this can still be added by acknowledging the pop-up and continuing. This is also true of adding the same medication with a different dose, as we could see prior. The Cancel button allows you to exit the window without saving any changes, since the system will automatically save updates. Medication interactions can also be checked from the current medication window. Once we have finished updating the current medications, including the statuses and adding any new medications, users will want to make sure that the Verify checkbox is selected. I can then either continue on to a different section of the progress note or exit out of the medication reconciliation window and see the changes reflected under the current medication section. That concludes this video. Thanks for watching.
Hello, in this video I will show you how to document allergies and intolerance. This can be accessed from the Progress Note Allergies and Intolerance section by clicking on the orange link. Allergies can also be accessed by using the toolbar A icon and the floating toolbar Allergies Intolerance icon as well. I'm going to expand our allergies window because this also includes medical history. Using the blue arrow, you can collapse or expand that section. Before I begin documenting allergies, with 𝒆𝒏𝒕𝒆𝒓, I have the option to see if external allergies have been documented. If external allergies were documented, they would be available here, and you would have the ability to pull them onto this patient's record. If the patient does not have any drug allergies, you would select NKDA. That's no known drug allergies. If the patient does have allergies or intolerance, we can begin by adding those in the search field here. Let's start with amoxicillin. After you begin typing, a list will appear below. Some of the allergens may display an icon for moiety. That indicates that that is a single drug and not a combination drug. That would represent a single NDC code. You can use the arrows to page over. In this case, I'll add amoxicillin. Then I want to select the reaction, the criticality, the type, and the onset date if known, and whether this is still active or it's inactive, and click OK to save it. If you've added a drug by mistake, you can use the trash can icon to the right to remove it. Next, I'm going to add an allergy to oak. In this example, we don't have an allergy for oak listed. I can add this to the patient still by using the Add Uncoded Allergy option below. Please note this is driven by a security setting. I am seeing a warning letting me know that uncoded allergies will not be considered in drug allergy interactions. I'll click OK to add it. I can also see the U icon, which tells us that this is an uncoded or unstructured allergy, and that is simply because it is not mapped on the back end to an NDC code. Therefore, it will not be available in the interaction checking and may endanger patient safety. You will see the same warning appear here. Any manual or free text entry of allergies will be excluded. I can change the order of the allergies that are listed by simply dragging and dropping it into the desired order. You also have the allergy log. If a patient would like a printout of their allergy list, you can go ahead and print that from here. The interaction button will display here, and this will be sorted by severity, by type, and you can also view it by medication. After you've completed entering the allergies, you will check the box Allergies Verified. You will notice back on the progress note that the U icon will also be present here, indicating to the users that this allergy or intolerance is not going to be included on the drug allergy warnings and the interaction checking when prescribing medications. That concludes this video. Thank you for joining me. This video will cover documenting surgical history and hospitalization in the progress note. The surgical history and hospitalization links can be accessed from the progress note. You can also access the same window by clicking on the scalpel and scissor icon found in the progress note toolbar. In this window, you simply need to enter the surgery or hospitalization item, the month and year it occurred, and then mark the sections as verified. If the patient denies any of these histories, use the check boxes for Denies Past Surgical History or Denies Past Hospitalization and then mark them as verified. Please note, if any surgery or reason exists in this list, you will not be able to mark the Deny checkbox. You can add to this list in two ways. You can use the keyword search boxes found on the upper left side. This will display a drop-down list of options. You can use the left and the right navigation arrows to see additional items in the list. When you find the item you want, select it, then proceed to enter the month and the year that the surgery occurred. In like manner, you can do the same for hospitalization. When you're performing a keyword search, you will also notice small star icons. These stars represent favorites. Click on the star to add it to your favorite. Next time you enter in the screen, you can activate your favorites by clicking on the large star icon found next to the keyword search field. When it's white, you are viewing all surgeries. When it's yellow, you are only viewing your list of favorites. Keywords can be added to this list by clicking on the plus sign. Please note that this requires a security setting permission to allow customization. Name the surgery. The name of the surgery is visible in the keyword search dropdown. However, if you add something to the notes field, that is what will actually appear on the encounter. Click OK to save the new item. Edit the name of the surgery by selecting the pencil icon, or delete the item from the master list by selecting the small x. If you added a surgery or hospitalization reason in error, use the trash can found on the right to delete it. You can also add procedures to the surgical history section by using the CPT code or CPT description. Once you find the correct CPT or description, select it. If you wish to change the order of the surgeries or the hospitalizations so they are higher or lower in the list, simply select the far left-hand column and drag and drop it in the desired order. This is the order that will appear on the progress note. When you are done verifying the surgery and the hospitalizations, be sure to click the Hospitalization Verified and the Surgical History Verified checkboxes. That concludes this video. Thank you for joining me.
Hello, in this video, we will demonstrate how to document the family history section of the progress note. The family history section can be accessed by selecting the Family History orange hyperlink on the progress note, or selecting the Family History icon from the progress note toolbar. In the Family History window, users will be documenting the life status and any medical conditions of family members that could contribute to the patient's health. On the left-hand side, users will see a list of family members. On the top, we can see the status, birth year, age, notes, and the ICD headers, which will display the different medical conditions available for selection. The ICD header display can be shown in either horizontal view or diagonal view. To add an additional family member, select the Add button. This will populate a new family member line where a user can then enter the appropriate family member that may be missing from the list. It should be noted, this will add a relative to this patient's record only. In the status column, users have the ability to select alive, deceased, or unknown from the drop-down. If the family member is marked as alive, and in the birth year column, we enter the year of birth for this family member, the age column will automatically calculate. To the right, we have our notes column. Notes can be added for each family member by selecting the respective notepad icon. From here, users can select a keyword from the column on the left-hand side to populate it under the selected section. Additionally, users can free type under the selected section. If users have been given the ability to customize the progress note, we can add to this list by selecting New. Along with the customization access, users can then edit or delete any of the options from the master list. If we wish to apply the selected conditions to additional relatives, we can do so by selecting them from the right-hand side. Once done, click OK, and we will now see that the selected family members have a blue notes icon indicating that there is information present. We can hover over the icon to see the information. The remaining columns to the right are specific medical conditions. To add a condition to one of the family members, click within the column, which will populate a check mark, and then users can enter the year in which the family member was diagnosed with the condition. We can hover over the year populated to see that it now states diagnosed year and the year we entered. If a family member has a birth year entered and we also add a diagnosis year, we can then see that the system will calculate the diagnosed age for this medical condition. To meet clinical documentation and reporting requirements, all family history conditions must be mapped to SNOMED codes. An administrator can do this using the Customize button found on the top right. This will show any of the medical conditions present under the family history, and we can then see the SNOMED codes. To associate a SNOMED code, select the ellipses, then search the appropriate code. If the medical history does not pertain to this encounter, or maybe the patient doesn't know the history, we can select the non-contributory checkbox. The Copy and Merge button can only be used to copy family history from another patient if they share the same guarantor found in patient demographics. If there are no patients available to copy or merge family history from, we will get this pop-up. Note that the Copy option will replace any existing history within the patient's family history window, and Merge will append it. If the patient has siblings and children, this can be indicated at the bottom of the family history window. We can then select whether or not the siblings or the children are healthy. Any additional notes can be added to the overall family history section using the Notes panel on the bottom. Once we are done completing our family history information, be sure to check the Family History Verified checkbox. Back on the progress note, any family history information that was entered will now appear. That concludes this video. Thanks for watching.
Hello, in this video we will discuss documenting the social history section of the progress note. We can access social history by selecting the social history link directly from the progress note, or by using the S icon found on the top of the progress note toolbar. There are multiple ways we can document social history. One way is by using smart forms. Particular items within the social history section may be mapped to a smart form. When the details column is selected and the smart form is mapped, it will launch the associated smart form window. Smart forms are structured data questions in a form layout that may include scoring calculations. Once the smart form is launched, proceed to enter in the appropriate information. Once done answering, click Save. The practice administrator can perform this mapping by using the Community Mapping Wizard. For more details regarding smart forms, please refer to our smart forms videos. Smart forms will be saved as a document in the specialty form folder found in patient documents. Back in the social history window, we will find the categories on the left-hand side. When a category is selected, there will be social history items on the right. For example, under General, we can see our different social history items available. Items with structured data associated to it will appear with a S icon to the left. Structured data is very important when it comes to social history, as it helps meet clinical documentation and reporting requirements. Before we jump into the details of structured data, we'll take a look at the options column. The options column will display a click-through field. When selected, it will change the response to one of the pre-configured options. Here we can see no. When selected again, it changes to yes and triggers a details question. Selected again, we have a blank option. Let's now take a look at structured data within social history. We're going to use the tobacco use and smoking as an example. I will start by selecting under the details column. Here we can see the structured data questions that are available under the tobacco use and smoking. Selecting the value column will allow me to enter the corresponding information to the question asked. Depending on the patient's answer to the question, a trigger question or questions may appear. On the bottom left of the social history window, we have the option to navigate to previous or next. We also have the ability to use the drop-down option, which will allow you to jump directly to an item that was previously populated. The default per category button is useful to document details quicker within the social history section. Be careful when selecting this option as it will override any current entries. The default per category option will set the default for whichever category is selected from the left-hand side. Defaults must be set up by the administrator or users that have access to customization. The clear category option will remove any details that were made. You can also use the small X found to the right of specific items to remove that specific note. If PDMP is enabled, this will allow a user to take a look at the prescription drug monitoring program. This is discussed at length in a separate lesson for prescription management. The SOGI option will allow users to navigate to the sexual orientation and gender identity preferences. If this information has been filled out previously, the selected options will appear. We can also make any changes needed for the patient from this window. Then we have the copy and merge option. The copy merge option will allow you to bring over social history details from another patient. This is populated based off of other patients having the same guarantor, such as siblings, through marriage, or partners. You will see any of those options displayed here. If you wish to pull the information from another patient, we have the copy option, which will overwrite any existing information, or the merge option, which will append it. Any additional notes can be added within the notes field below. Once you have completed documenting your social history details, be sure to
Hello, this video will cover documenting the review of systems, or ROS, in the progress note. The ROS can be accessed by clicking on the ROS link in the progress note. It can also be accessed by clicking the R icon found in the progress note toolbar. When you open the Review of Systems window, you will see Category Systems on the left and Symptom Items on the right. Each category has a search field atop the symptoms to narrow down the list. For example, cough. To document the systems, you can use the small black arrow in the middle column to pull forward the individual item default if one was set up. For example, the default for cough is no. If I want this to be yes, I can click on the presence column and change it. This is a click-through option. Click the notes to then document the details. On the left, you will see a list of customized options. Those with customization permissions will be allowed to add additional notes to the list using the Custom button. Select the note to pull it into the right pane. If you wish to add common notes to your favorites, select the star found to the left. You can enable favorites by highlighting the blue star atop of the options. If it's yellow, you are viewing only your favorite list. If it's blue, you are viewing the entire list. You can use the next and the previous buttons found on the bottom right to quickly navigate to the next symptom in the list. Any item already documented will appear in the drop-down arrows on these next and previous buttons. This will allow you to navigate to those easily and make edits if needed. Click OK to save your notes. To apply default for all of the categories, you can choose Default for All. To apply defaults to only this category, select Default per category. Use the Clear All or Clear Category to remove any errors. You can also remove individual item notes by clicking the small X found to the right of the note. The Default per Category drop-down caret will display any mini template defaults created for you as a user. Please refer to the lesson on customizing progress notes and templates for a more detailed lesson on this. To add notes to the overall review of systems, you can use the large Notes section found on the bottom of the Category Item tabs. That concludes this video on review of systems. Thank you for watching.
Hello! In this video, we will demonstrate how to document vitals within a patient's progress note. Let's begin by navigating to the patient's progress note and selecting the orange hyperlink for vitals. Let's run through an overview of the vitals window. The yellow highlighted grid will indicate the date in which the encounter is present. Any vitals with an asterisk will be considered as mandatory. Back on the vitals window, to the left, select the gear icon. Here, users can select which data set will be used to calculate the patient's vital percentiles and the default growth chart view. Normal data set for CDC/WHO per practice settings, data set for Fenton growth chart for preterm infants. The users can enter the gestational age in weeks. And lastly, Down syndrome data set for CDC. Back in the vitals window, toward the center, the patient birth vitals can be accessed and entered. Here, users will see two tabs, the birth information and the hearing and 𝒆𝒂 score. Within the birth information tab, users can see the date of birth, enter the gestational age in weeks, then enter the weight, length, and head circumferences. All three value measurements can be changed by selecting the perspective dropdown. The information entered under the birth vitals display on the patient's growth chart. To the right, the weight change since birth will calculate. Any additional information regarding the birth information can be entered under the notes. Please note that the standard vital typing mapping can be defined in length or height. This too can be determined under the ECW menu, EMR tab, Vitals, Configure Vitals, Additional Configuration. Under the Hearing and 𝒆𝒂 tab, users can enter the newborn hearing screening information and the 𝒆𝒂 score information. Back on the Vitals window, users can then check off the Display Birth Vitals within the patient's progress note and Display Past Vitals. We will cover the Vitals Taken option and pop-up options shortly. To the far right, users can select the Filter button. Here, we can select the vitals options we wish to display for this particular patient. This will be based off of the appointment provider, appointment facility, and visit type. It should be noted, even when different filters are selected, the current encounter will display even if selected filters excludes it. Once the filter has been selected, click the Apply filter, and we'll see the filter criteria appear on the Vitals window. Below, the users will see the encounter date, the different vitals that have been taken for that particular encounter. Click on the Vitals column to begin documenting your vitals. Notice a pop-up window appears. This is because we have the pop-up option selected. If we do not want this to appear, uncheck this, and the users will then type directly into the grid. However, users might be missing information within the pop-up such as qualifiers. These can be used to document repeat vitals and patient positions and more. Users can add additional vital entries by selecting the plus sign. If a default has been set up for that vital by the practice administrator, this can also be selected. Additionally, users will note that the pop-up option allows users to check off the Not Taken option. If the Not Taken reason option is selected for a vital, the pop-up window will then change and the users can select a Not Taken reason from the drop-down menu. Otherwise, within the pop-up, either free text under the value field or use the keypad to enter the vital information to move on. Use the left-facing or right-facing arrows. This will automatically save the information and navigate to the next tab. By clicking Apply or Enter, this will save the content and close out of the pop-up window. Within the Height column, users will see a copy option. This will take the previously documented vital data and apply it to today's encounter. If a patient does not have a prior vitals documented, the copy button will not be functional. If values entered are abnormal, the entry will display in red, providing that the vital range has been configured, or a user may get a pop-up message indicating the vitals are out of range. The bottom left of the vitals window, users can access the growth chart and graph. For more information regarding the growth chart, please visit our support portal and view the video Growth Charts. On the graph, the user will see the vitals on the right, checking off the options that will display on the graph. Users can then select the time frame of the graph on the top right-hand side. Once the options have been selected, a line graph will appear. Hover over the different data points to see the encounter date, vitals, and the vital values. Users can print the graph as needed. Back into our vitals window, over to the right-hand side, users can select the drop-down to choose how many encounters will load by default. To the right, we can change the view of the vitals window by selecting View More Recent Vitals or View Older Vitals. Below, you'll note that additional details on vitals can be entered in the lower notes field. You can free text or click on the ellipsis button to display your list of keywords for selection. Once everything has been entered, make sure to check off the Vitals checkoff box in the upper right-hand corner. This will display a stethoscope in the office visit window, indicating to your clinical staff that the vitals have been completed. It is important to note that any vitals with an asterisk sign must be documented. Once the user selects the vitals taken, the user will receive a pop-up message indicating the following. The following vital signs are marked as mandatory and do not have values entered. Please select an exception reason or click the cancel button to go back and enter the values into the vital window. The user can select the exception reason for each individual vital, or they can select Set Exceptions for All. Once selected, you will receive a green check mark listed to the right. You will select Save and Continue. Please note that the reasons can be configured under the ECW menu, EMR tab, Vitals, Configure Vitals, Additional Configurations, Vitals Not Taken, Exception Reasons. Things to keep in mind when entering the vitals is that the height and the weight should only have numeric values so that the system can properly calculate the patient's BMI. And special characters should never be used when entering the vitals. It may interfere with certain processes such as migrating vitals, the registry reports, quality measures, and EBO reporting. This concludes our video, and I thank you for watching.
Hello. In this video, we will cover the past results section of the progress note. The past results can be found under our objective section, and then you'll see past results. This section will remain blank until past results are carried onto the progress note, and this can be done within the right chart panel. You'll navigate to the DRTLA tab, and this will display the labs, diagnostic imaging, and procedures. You can use the drop-down at the top to adjust the date range filter in the orders that you want to display. All of the options that are available here, aside from patient timeline, will group the orders by their type. Patient timeline, however, will then just display the orders based off of when they were ordered. You will then see for labs, they're broken down by outstanding orders and resulted orders. For diagnostic imaging and procedures, you'll see that you can use the drop-down to adjust what you'd like to display. Each of the sections can be collapsed and then maximized once again. The outstanding orders that are displayed indicate that the results have not been received and the lab has not been reviewed. Additionally, if you see the exclamation mark, that indicates that those items are high priority. Below in the resulted orders, you'll note that some have the left-facing arrows. Those signify that the results have been received and they have been reviewed. If you do not see the arrows, that indicates that the results have been received. However, they have not been reviewed and cannot be pulled into the past results just yet. However, these orders are able to be opened and reviewed from this location. You can navigate to the individual order, double-click on it, and that will open up the lab results to be reviewed, and then you can mark it as reviewed and select OK. Then, when it's refreshed, you'll see that the arrows have now appeared. Another option that's available is the View All Reports. If you hover over the tooltip, it'll indicate that all unreviewed results for the patient are shown here. If we choose View All Reports, that will open all of them up. You have this section along the top that allows you to apply this information to all of the orders and mark them all as reviewed. If, however, they need individualized notes, you can navigate through, and each one has a panel on the right-hand side that you can fill in the details as needed. Once those details have been populated, select Save, and that will update within the right chart panel. Now we'll merge in our results. You'll see the first arrow will allow you to pull in the single result into the progress note. The second arrow will pull a cumulative report for the order. We'll first select the first arrow, and you'll see that that is going to pull the results into the past results section. This will include the order name, the date, collection date, results, and any notes that were entered. The second arrow will pull the cumulative result. This will include the order name, the attributes if applicable, and then separate columns for the different order dates. Any notes under the different order names will appear under the respective column. The cumulative report allows users to see a trend of the results. Note, when the results have been merged, the arrows will turn green. This allows users to see which orders have already been merged into today's encounters. To access the past results window, you will select the respective hyperlink. You are able to see the order name, the order type, and the collection performed date. If a result was merged by mistake, select the trash can icon to remove it. It'll verify that you're wanting to remove it, choose yes, and that will be removed. You are also able to select the lab name to open the results window. You will also be able to open the results window for any order on the right chart panel or that have been merged into the past results section by selecting the name. Please note that the results and reference ranges will be displayed on the progress note only if the reference ranges have been configured. This workflow is similar for the diagnostic imaging and procedures. And that concludes this video. Thank you for watching.
Hello, in this video, we will discuss documenting the examination on the progress note. The examination can be accessed by clicking on the orange examination link from the progress note. You can also access this section by using the toolbar RE icons. Similar to other sections, the user can merge examination data from past encounters by selecting the yellow caret found next to the examination link. Within the examination window, you will see similar categories and subcategories on the left and the observation fields and notes on the right. Again, these can be selected, free-typed in, or if you want to merge all of the default values for all fields, click the Merge Default button. Otherwise, you will click on the right-facing arrow next to each field to merge the individual default. The Select Default option dropdown will allow the user to save the items that were entered as a default and create a mini template for each specific category they are in. To create the mini template, enter the desired default observations and click Save As. Enter the template name and click Save. After you create that template, you will then have the option under Merge Default to use that template. The column with the paperclip allows you to attach an image within that individual observation field. Click Add, select your image, open, use the ink edit tool to make any annotations, and you will see that appear here. Similarly, the drawing button on the examination window will allow you to upload an image for the examination section in general. To collapse the categories and subcategories, click on the left-facing blue arrow and expand them by clicking on it again. You can search the categories, and you can also search the items within the category. You can also use the Order Categories button to change the order in which the categories will appear on the progress note. Simply drag and drop and click OK to save. If you would like to change or delete an observation, use the X to the right, or click in the observation field and use the key text words found here. On the bottom, you can enter General Examination Notes. You can use macros or the list of keywords found here, and you can also use Smart Notes if configured. To expand the examination note section, click on the upward-facing arrow and click it again to collapse it. Looking back at the progress note, after completing the examination section, you will see all your documented notes appear on the progress note, along with the category level image, and the overall examination image will appear at the bottom of the categories. That concludes this video. Happy learning!